Hello, welcome to the final session for Writing Week, and particularly a warm welcome to physiotherapists, occupational therapists, and speech pathologists, which is the focus of today's session. We have been running sessions all week for the different OET professions. There's been a session covering each of those professions. If you're joining today and you missed the dedicated session for your profession, you'll be able to see those videos from the OET YouTube channel at Official OET. But now you're here, please do stay for the rest of today's session, because what I've been doing all week is explaining that the tips that I can share today for the specific professions do apply to all OET professions taking the writing test. So you're definitely going to learn some things that you can apply to your profession, regardless of whether today is for you or not. But today we will be looking specifically at new case notes for speech pathologists, physiotherapists, and occupational therapists. And the purpose of these sessions are to be as interactive as possible. And this means that I want to see your opinions and read your comments as we go along. So please make use of the chat box in your social media channel. But I'm also going to ask you to regularly vote in some poll questions. And I want us to practice using this feature now. If you have a second device handy, you might want to use that, or open a new tab on your current browser if you're on a laptop or computer, so you can easily move between the live stream and the polling software, which is called menti.com. But we're posting into the comment box now the first question, which is, have you written a letter for the new set of OET case notes that have been given out for your profession? So click on that link. And it's a really easy question for you to answer. You can see you've got two options to choose from, either yes or no. Let me know if you have already written a letter for the new set of OET case notes that we released for this week. That's great. I can see some responses coming through already in the poll. If you can't access the poll, feel free to put your comment into the chat, either on Facebook or YouTube, wherever it is that you're joining us from. So I can see at the moment on the poll, most people are saying no, they haven't written the letter yet. That's going to be absolutely fine. As we go through the session today, you'll learn some tips about writing your own letter, and you can have a go at writing it after today's session. So it looks like the majority is sticking at the no point. So let's move on to the second question, which is, when are you taking OET? So for this question, again, click on the link which is in the chat right now, and let me know what date you've booked for your OET test, which month, which date, when are you planning to take OET, or you can let me know in the chat as well. Any of those is fine. I can see December has come up for a few people. Also a February, so that's nicely into the future, forward thinking. Someone is coming into October, so that's just next weekend, which is great. Couple for that date in October. December looks like the most popular though at the moment. Someone's come in for November as well. That's great. Lots of answers coming through. I'll just give you 10 more seconds if you are answering the question, just to put it into the chat. Fatima is saying October 9. Hopefully, Fatima, were you the optician who submitted a letter yesterday? Hopefully that was helpful for you. Great. So yeah, it looks like most of you are looking at October, November, or December. October and December are the most popular. December also coming through in the chat, so that's great. Now, the third question that I want to ask, as I mentioned, we've got a variety of professions being covered today. Type in your OET profession. So let me know, what is your OET profession? It doesn't matter if you're not one of those that we're focusing on specifically today. The videos will be available on the OET YouTube channel for you to watch your specific session, and you'll certainly find helpful tips from today's session if you can stay now that you're here. So that's great to see. We've got physiotherapy and speech pathology joining at the moment, also nursing and optometry, medicine as well joining. I can see that on chat and on the screen as well. Have we got any occupational therapists in the room? That's our other focus for today. Oh yeah, I can see somebody on chat coming in as occupational therapy. So that's great. We've got all three of the focus professions represented today. It's lovely to see the other professions here too as well. You're all very welcome, and hopefully the tips will be useful for you as well. All right, so now we're familiar with the software. Let's get started on our writing week session. So I'm going to start with physiotherapy today, and then I will move on to speech pathology and finish up with occupational therapy. Now, if you registered in advance for this session, you will have received an advance copy of the case notes we'll be looking at today. And some of you will also have submitted your letter for these case notes. And I'll be using those letters during the session to demonstrate to you what the assessors are looking for in your writing. We're going to look at the case notes now together and pick out the key information the reader needs to communicate. So if you haven't had a chance to look at the case notes before, or these case notes aren't specifically for your profession, you can look at them with us now. And you can download a version from the chat. It's popped up as a link, so you can download your own version. They might be a little bit small for you to read on the screen, but I'm also going to zoom in on different sections as we talk about it. So with that, I'm going to turn off my camera to make the screen as big as possible to show you the case notes. So these are the physiotherapy case notes, and I'm going to talk you through the information selection process. So first of all, we need to understand the basics of our role in the letter, and we find this in the notes section at the top. And we can see that for this scenario, we are a physiotherapist writing about one of our regular patients, and the patient's details are just below, Mrs. Doris Abrams and her date of birth. Next, we need to make sure we understand the reason for writing the letter, and it's a good idea to read the writing task a couple of times to make sure you fully understand it and have noticed all the information your letter needs to communicate. So have a look at the writing task as it is on the screen now. Doesn't matter if this isn't your profession, you can still answer this question that we're posting into the chat now. Tell me how many reasons for writing you can see in the writing task. And you've got options of 1, 2, 3, or 4. So take a look at the writing task as it is on the screen. And then either in the chat or in the poll, let me know how many reasons for writing you can see in the writing task. That's great. So someone's kicked us off with an answer of 2 reasons for writing. Do you agree? Can you see 2 reasons for writing? Can you see any further number? In the chats, someone's come through with 2 reasons. That's certainly the most popular answer in the poll as well on the screen. Aliyah is saying 2 as well in the chat. 1 is coming through as a possible option, and 3 as well. It's always good to have difference of opinions, and then we can check together in a second. So I'll give you just 10 more seconds to answer this question if you're trying to answer the poll now. 2 coming through from Ruhala on the chat. All right, so thank you for those responses. Let's look at the writing task together. So the correct answer is 2. This is to inform her, which is the patient's doctor, for your suspected diagnosis and to request further investigation. So there's two reasons for writing the letter, and it's important to make sure that you cover both of those reasons for writing in your letter, whichever profession you are. Another tip is that it's also a good idea to check the last section of case notes to see if there's any additional detail provided about the reason for writing. So from the final section, which is called treatment, we can find more details about the further investigation request in the writing task, which is to specifically request blood tests and x-rays as necessary. If we now look at the patient's treatment record, we can see that the patient presented in January this year with pain in her right wrist, which you diagnosed as a sprain. Sorry, just flipping ahead. And the patient suspected it was caused by a netball injury 2 days prior to that visit. And that seems to have resolved itself by the time you reviewed it a week later. That then brings us to the 15th of May, which I note is the same date as the one I've been given to write the letter. And on the 15th of May, the patient presents with dull aching pain in her fingers and occasionally in her feet, which isn't related to activity, varies in presentation, and is disturbing her sleep. She mentions morning stiffness lasting an hour, unusual fatigue, loss of appetite, and a 2-kilo weight loss. The results of your examination are listed, as well as your possible diagnosis of rheumatoid arthritis. And finally, notes from your discussion includes the patient's concern about rheumatoid arthritis due to a family history and her agreement to see her GP and return to you, the physio, for education and management if diagnosed. Finally, let's look at the other section of case notes, which we haven't looked at already. And again, I'm going to ask you to look at these and tell me the answer to this question that we'll post into chat right now. Which of these case notes are irrelevant to the reader? So we can see headings down the left-hand side: social background, family history, medical history, her current medication, and her weight, height, BMI. So if you click on the link in the chat right now, you'll see in the poll, I've listed those headings, and you can choose more than one to let me know any that you think are irrelevant to the reader. So let me know, if you were writing this letter, which of these case notes that you can see on the screen right now would you omit from your letter because they're not specifically relevant to the reason for writing, which, remember, is to inform the doctor of your possible diagnosis and to request further management. So let me know in the poll or in the chat, which of those case notes would you consider irrelevant to the reader? We've got some responses coming through now. So weight, height, and BMI have a couple of responses in there as irrelevant to the reader. Here's some more responses coming through. We've now got similar numbers saying social background, medication, and the weight, height details are irrelevant to the reader. Yeah. That's great. So I'll just give you 10 more seconds. If you're trying to answer that poll question, you can add your responses now, or let me know in the chat. So Jilu in the chat is saying social background is irrelevant. Great. So from the responses on the screen, and Posty on chat has just come in with weight, height and BMI. Let's look at it together. And I would agree that the social background can be omitted because it's not relevant to the current situation, and it's also likely to be already known by her GP. The weight, height, BMI, as many of you mentioned, and the medication details can also be omitted, but the family history and the medical history do link to today's current situation. So those details should be included. The ones that are highlighted on the screen should be included. The rest can be omitted. So in your 5 minutes of reading time, whatever your OET profession, you get the 5 minutes prior to your 40 minutes writing time. You need to work out the specifics of the situation and the information you need to communicate. And this table that I'm putting onto the screen now summarizes all of these important details and helps to make sure that you don't leave anything out. So while you're practicing, you can use the table. The headings on the left-hand side work for all professions, and you can actually copy those headings perhaps onto some paper and write in the case notes, or if you like doing things on computer, you can set the table up on your computer and copy and paste details from the case notes. But you can complete this table while you're practicing. Then by the time it comes to test day, you'll have those headings memorized and you'll be able to search for those details while you're reading. And then once the writing time starts, spend a couple of minutes underlining or highlighting the case notes that you selected in your mind and roughly planning the structure of your letter. So we had a few physiotherapy letters submitted in advance of writing week, and we're going to use these to focus on their strengths and weaknesses against the writing assessment criteria, so you understand what you need to do and avoid when writing your own letters. So here is the first letter, which was submitted by Susie. Thank you very much, Susie, for submitting it. I'm going to give you 2 minutes to read it. And if you haven't seen the case notes before today, try putting yourself in the reader's shoes. Remember, the reader is the patient's GP. And then comment in the chat box to say if you feel by the end of the letter you are well informed about the current situation or you're left with some questions. So just take a couple of minutes to look through the letter, think about the reason for writing, and then let me know in the chat whether you feel well informed as the reader by the end of the letter, or you feel you would be left with some questions. So just give you 1 more minute while you quickly look over the letter on the screen. Do you think this is a good response to the writing task, or it would leave you with some questions? I think everyone's gone shy, which is quite all right. Let's just have a think about it together. So what I would say, and you may have noticed this yourself, what's missing from these case notes is that there's no mention at all of the blood tests or x-rays, which we saw came at the end of the case notes just above the writing task, and specifically mentions the kind of further support and management that the physio is requesting from the reader. But let's look at it in a little bit more detail. So looking just now at the first sentence of the letter, this is another poll question for you to answer. So again, anyone can answer this question. Do you think the reason for writing has been clearly explained at the start of the letter? And you've got 3 options to choose from in the poll. Do you think yes, partially, or no? So click on the link if you'd like to have a go at answering the poll question. That's great. I can see we've had a response already. So we've got 1 each response for yes and partially. What do you think? Do you think this is a clear explanation of the reason for writing? It's just a partial explanation, or perhaps you think this isn't a very good, clear explanation? On chat, Alea is saying, I think partially. Partially is starting to get more votes in the poll as well. And we've now got someone who's suggesting it's not a very clear explanation. Robin is also saying partially in the chat. What do you think? Posty is saying yes in the chat. Samim saying partially. All right, so just 10 more seconds if you'd like to answer the question, either in the poll or in the chat. All right, so the most popular response from both the poll and the chat was definitely a partial. This is partially clearly explained. And what I would say is the reader certainly knows straight away why the letter has been written. So it's to request further investigation. And what is the high level requirement from them? So it's been written because the physiotherapist suspects a diagnosis of rheumatoid arthritis and is requesting further investigation. So that bit has been done well, but it could have been improved by making the connection between the reader and the patient, perhaps by including your patient, Mrs. Abrams. That would have made the connection even stronger. And of course, as we mentioned, the blood test, the x-rays and so forth, that can come later in the letter. That's where you expand the purpose later in the letter. So it doesn't matter that that's not here at the front. But what we do need to have is done pretty well in this reason for writing is to explain that reason and what is expected of the reader. So my tip here is check the case notes for existing relationships between the patient and the reader, as well as between the patient and you as the writer. And official OET case notes will make these relationships clear, so you won't have to guess. And if there is an existing connection to the reader, then make that clear that they are an existing patient at the start of your letter. All right, I've got one more question to ask you about this letter, and that is, are these time phrases that you can see highlighted on the screen now, are they useful to the reader? And for this poll question, you can see the link in the chat now. You can drag your answer. There's a sliding scale between useful and not useful. So you can let me know your opinion. Do you think these time phrases today and previously visit on 3 January 21 are useful for the reader or not useful? So let me know in the poll. I can see some responses coming through. We've got an option for useful has been selected. So you can choose any point of that scale. You can choose useful, not useful, or somewhere in the middle. Robin on chat is also saying useful. Jacqueline as well saying useful. Posty, useful. Fatima, useful. Aisha, useful. And certainly the poll is more along the lines of useful. It's come down a little bit from where it was, but it's still much closer to the useful end than the not useful. Athira and Anju are also saying useful. All right, just give you 10 more seconds if you're trying to answer the question. That's great. So I would definitely agree with you. Those of you saying that these are useful. Time phrases are certainly helpful for the reader's understanding of the timeline of different events. And my tip here, which is for organization and layout, is to think about the clearest way to organize the information for the reader. Sometimes this will be by time period, sometimes by topic, and include time phrases when describing the history of the current situation to further clarify things for the reader. So overall, I would say about this letter, there's a lot of good things. It communicates most of the main details that the reader would need to know. What I would suggest Susie needs to work on is properly expanding the reason for writing at the end of the letter. We picked up together earlier that there was no mention of the blood tests or the x-rays, but also not adding details to the letter which weren't in the case note. So this sentence you can see highlighted on the screen now is really an opinion or a justification that this candidate has added to the letter, and there's nothing about this in the case note. So don't add things. Everything that you need to communicate is provided for you in the case notes. All right, so here's a second letter. This one was submitted by Anne. And again, I'm going to give you just a couple of minutes to read through the letter that you can see on the screen now. And then let me know in the comment box whether you think this letter that you can see from Anne has successfully explained the reason for writing. So let me know in the chat whether you think this letter is successful for explaining to the doctor, to the GP, why they are receiving this letter. Okay, I'll just give you one more minute to look through the letter. Let me know if you think this successfully explains the reason for writing. Robin in chat is saying successful. What do you think? Do you think this successfully explains the reason for writing? Jacqueline in the chat is also saying yes. Hamid, yes, it's successful. Posty as well, yes, it's successful. Alea is saying yes, but I guess use the word confirm rather than check, which comes at the end of that sentence. And so confirm the diagnosis rather than check the diagnosis. It's a good idea. Samim is saying successful. Great. So I would agree with you. I think the letter includes the reason for writing and then expands on it, all within the first paragraph. And this is okay to do. Where the requests are short, like just requesting blood tests and x-rays, you can certainly put it all into the first part of the letter. It would also have been fine to move that second sentence to the end of the letter. Either position is fine, particularly when those requests are short. So I'm now going to ask you to look at one paragraph in particular. This is paragraph 5, and I want you to let me know in this poll question whether you think any important details have been omitted from paragraph 5. So this is your assessment of your patient today. If you've got the case notes to hand, you might want to have a look back at the section of notes about today's visit on the 15th of May. And then just let me know in the poll question, anything you can spot from the case notes that has been missed. So you can write your own answer in if you can spot anything you think that has been missed from the case notes about today's session. What do you think? Thinking about today's session on the 15th of May, have any details about that session been omitted from this paragraph, in your opinion? Could be a tricky question if you can't see the case notes as well, but yeah, that's great. We've had some people popping in some answers. So there's no mention of sleep disturbance. Sleep has come in a couple of times. Family history isn't here, but perhaps that might have been mentioned in a different paragraph, but certainly the patient's concern about the family history. That's a good suggestion as well. I can pop back to the paragraph. Hamid, there you are. You can see on the screen again. Anything you think has been missed? So yes, sleep disturbance seems to be the main thing that people have noticed is missing. Systemic symptoms from Samim in the chat. Yeah, so what I would say about this paragraph is it does end quite abruptly. We've got sort of a closing sentence right on the end of those details about today's visit, and therefore some of the details have been omitted. Things like the sleep disturbance, as was being mentioned, but also things like the grip test results, the gait assessment. These are also missing from this letter. So my tip here for content is to make sure you use the 5 minutes reading time to check the case notes carefully for which details will be most important for the reader. And the headings in the table we looked at earlier will also help you with this while you prepare for OET, to make sure you select the details to include and omit those that are irrelevant. So one final question about this letter. So we can see here the main paragraphs of the letter. And I would like to know, if you had written this letter, how would you have organized the paragraph? So there's 5 paragraphs you can see on the screen. Would you have put them in the same order, or would you have put some of this information in a different order? So you can rate the paragraphs in the order that you have them. They're 1, 2, 3, 4, and 5 on the screen now. In the poll question, if you click on the link, you can reorder them. So you might want to have a look at this on the screen now and mentally give them a number, and then think about what number order would you put those in yourself. So rearrange the paragraphs in the poll question to the order that you would put them in. how would you have organised the paragraphs? Which ones would you have had first? What would you have had next? And so on and so forth. So you might again want to look at the case notes. Think about what would be most relevant to the reader. How would you organise the paragraphs? Maybe I've made this question a little too difficult. All right, let's look at it together. It's maybe a bit tricky to do reorganization when you can't see what's going on. I can see we've had a few results come through on the poll, so thank you for trying that. But let's talk about it together. The reader would be much more interested in what has led the physiotherapist to suspect rheumatoid arthritis. And so the paragraph that's currently in the second position, the social details, are much less important. And what this candidate seems to have done is follow the order of the case notes rather than considering the reader's needs. Hamid is saying, I will not put one sentence in paragraph 4. Yeah, that's right. We could certainly put that paragraph as well together with the details with the 3rd of January, if in fact it's particularly relevant to the reader in any case. So another tip about organisation and layout is to make sure you organise your letter in order of importance to the reader. If you were in their shoes receiving this letter, which information would you want to know first? And then what information? And then what information? So don't organize it in a way that you think is important or the order that it's given in the case notes. Always think about what would the reader want? What would be most useful and clear for the reader? So overall, the writing in this letter is clear and mostly appropriate, but omit thank you from the end. This isn't needed after your closing sentence. It also has a strong purpose. What this candidate needs to work on is selection of the details to include and prioritize so that the key details are not omitted, as we saw in the final paragraph, and irrelevant details are given near the front of the letter. So we've got 2 more physiotherapy samples to look at. And with these, I'm going to pick out a few overall comments for you. So this first one was submitted by Yuplung. So thank you very much for doing that. And I want to remind you about the need to make your reason for writing the letter immediately clear for the reader. There's actually no mention of this in any shape or form until the final paragraph, which would have meant the reader is kept guessing and a little bit frustrated until then. In terms of organisation and layout, this letter is missing the RE line, the regarding line from the front of the letter. And for genre and style, thank you is also not suitably formal as a closing sentence. There's also no requirement to include your name at the end of the letter. Just your job title is sufficient. So this letter would need quite a bit of work to be test ready because it hasn't specifically been organised for the reader. And again, like the last letter, follows the order of the case notes. And there are quite a few little mistakes in the writing. These wouldn't cause too much difficulty for the reader's comprehension, but it's definitely good to work on your language accuracy. And this final letter, which was submitted by Vanessa, thank you to Vanessa for that, is also organised in order of the case notes, but it does at least have a clear reason for writing, which has been expanded on later in the letter. This could have been better summarised into one sentence. So, for example, it would be appreciated if you could arrange blood tests and x-rays to check for rheumatoid arthritis rather than the 2 sentences that are there at the moment. And my tip for this letter is when writing about a condition which has an abbreviated form, like rheumatoid arthritis, the recommendation is to use the full form the first time and add the abbreviation in brackets afterwards, as you can see on the screen. And then for subsequent mentions, you can use the abbreviation only. My final tip is to be careful when writing on paper or on computer to use any time you have at the end of the writing test to look for typos, especially with the patient's name. You can see here that this candidate has missed the S off the patient's name all times apart from in the RE line. So that's something to be checking for. Most of the necessary details have been included, which is another positive about this letter. So if you are a physiotherapist watching, please add your opinion to this question before we move on to speech pathology. So I'd like to know if you have learnt any useful tips to improve your writing from looking at the samples. And you can add that to the poll now, yes, no, or not sure. And what we're also going to do while you answer that question is to share the link to the official sample letter for the case notes so that you can compare them with your own. So these case notes and sample letters will be available on the OET website early next week. But if you have used the case notes already, you can download the sample letter now to have a look at in your own time. So that's great. The majority are saying, yes, this was a useful session. So let's move on to speech pathology. If you are a speech pathologist in the session, say hi in the comments box now, and then we'll know who you are. I know there were a few of you saying you were here at the start of the session, so hopefully you've been able to hang on while we went through physiotherapy, and you can now bask in the limelight. This is your turn to talk about speech pathology. If you haven't seen the new case notes for speech pathology, you can now download them from the link that we're posting into the chat now. That's great. So Hamid and Robin are both saying hi. I take that to mean you're both speech pathologists, so it's great to have you here. And like I did with other sessions, I'm going to go through the case notes now that we've just posted into the chat. And so if you haven't seen these already, you can go through them together with us to see what's important to include. Hi to Afril as well, saying hi. Hopefully that means you're a speech pathologist as well. So here are the speech pathology case notes that we just linked to in the chat, and let's look at what we need to include for this letter. So again, starting at the top, we need to work out what our role in the situation is, and the notes tell us that you are a speech pathologist in a private practice and that your patient has muscular sclerosis and is relocating to Mountford, a new location, and needs a letter to his new speech pathologist there. And the patient's name is Mr. Henry Max, and his date of birth are presented below. Looking now at the writing task, again, I'm going to ask all of the speech pathologists present, but everyone else as well, to look at the writing task in detail and let me know how many reasons for writing you can see for this specific writing task. So let me know. We're posting the link to the poll into the chats now. How many reasons for writing can you see for this writing task? Hi to Jespin as well, who's said hello to show that she is a speech pathologist. Have a look at the writing task for speech pathology on the screen now, and let me know how many reasons for writing you can see in the writing task. The poll question is open. You can choose from 1, 2, 3, or 4. All right, so 2 is coming through now. in the chat. Do you agree? 3 coming through in the poll. Oh, okay, that was a mistake. 3 from Jacqueline as well. 2 in the poll. 1 from Fatima. 2 from Robin. Okay, I'll just give you 10 more seconds if you want to answer that question. How many reasons for writing are in the writing task for speech pathology? Does anyone want to cast a deciding vote in the poll? There we go. 1 has become the overall favourite in the poll. All right, well, let's look at it together. So in this writing task, there are actually 2 reasons for writing. These are to outline Mr. Mack's case and give your recommendations for his ongoing management. Now, outlining the patient's case sometimes is more of a reason for writing than in other situations. Because you're writing to a new speech pathologist who doesn't know anything about this patient, outlining the case does become the reason for writing. But in some other scenarios where the reader knows the patient, the outline isn't the reason for writing in itself. It's the other parts of the writing task that are the priority. But here, outlining Mr. Mack's case, giving your recommendations for his ongoing management are equally important and both parts of the writing task. So let's look at the final section of case notes to understand these recommendations a little bit further. And we can see from this section of recommendations, there's quite a few extra details about what you as the current speech pathologist are recommending in terms of how the new speech pathologist will continue care for the patient, Mr. Max. It links to the type of diet that he should eat and assessment and strategies the new speech pathologist should coordinate. So looking back at the treatment record, we can see how the patient's condition has declined from his first visit in 2008. Oh, sorry, I've sped ahead from where I should have been. Let's talk about, first of all, the medical background and the medical progress. So I hope that you'd agree that all of these details that you can see on the screen right now don't need to be included in the letter because the current situation is linked to his speech only, and a lot of the medical process is to do with his mobility. And we've already found his diagnosis from the notes section to know that he has muscular sclerosis. Now looking at the next section, which is the treatment record, we can see how the patient's condition has declined from his first visit until 2008 until the most recent visit. So I want you to look at the 3 sections of case notes on the screen now. We've got them for 2008, 2014 and 2019. So 11 years that you've been treating this patient. And I'd like you to type into the poll how you would summarize those case notes into one sentence. How would you summarize the visits or the treatment from 28 to 2019 into one sentence? Let's open up the poll now. So if you've had a look at the notes, either you've got your own copy or you're looking them on the screen now, I want you to try and summarize for me into one sentence. Perhaps think about what has changed in those 11 years. What is the summary of your understanding of those notes? So we've got to describe the changes in his condition over time. Yes. How would you put that in a sentence? Can you write a sentence that describes those changes for me? What specifically has changed, would you say, between 2008 and 2019? Just give 20 more seconds if anyone wants to have a go at writing a summary sentence. All right, let me give you my suggestion. So I would suggest something like, Mr. Mac's condition has deteriorated so that he now eats a soft diet and needs his medication crushed. You need to obviously focus on the details that have an impact on the final outcome. Remember, the patient's situation now is quite a lot different to how it was back in 2008. And the new speech pathologist doesn't need all of that history. They just need to really know that it has deteriorated, as would be expected with a condition like muscular sclerosis, and what their current position is. So Robin's suggesting over the past 11 years, the patient's feeding and speech abilities have deteriorated. Yeah, that's a good summary. And this is how you can usefully spend some of your reading time. So as well as reading the case notes line by line and for detail, another good tip is to try and then summarize it just in your mind, in your own words. What does this mean? What is the history? How has it changed? There's quite a lot of detail in these case notes. You can't include all of it in your letter. You don't need to include all of it in your letter. So summarizing chunks of the case notes, like the treatment record, into a single sentence can then help you when it comes to the writing time to be more efficient and give a better summary to the reader. So let's look at what the assessment was found today. So today being the 15th of May, this is the same date as we've been given to write the letter. So we know that the patient was hospitalized with a chest infection, and a swallowing assessment was requested by the doctor. And this is obviously going to form the majority of our letter. It was today, it's a swallowing assessment. It specifically relates to our reason for writing to the new speech pathologists. And we can see that the assessment covers both oromotor and swallowing exams, plus it includes a couple of conclusions at the end, which are quite nicely summarized already for you to be able to pass on to the reader. So this detail is going to need to be included in full. It's the most important detail for the reader. You need to make sure you have time to include all of this detail in your letter. Looking at the final section of the case notes, we can see that the only detail from here which is useful to mention is that the MS that the patient has is secondary progressive. So you need to look at these case notes, filtering them for details about the patient which impact the reader and omitting everything else. So here on the screen is a table of that most important information, and this will help make writing the letter easier. So as I mentioned, this works for all professions. You can use the headings on the left-hand side to identify the most important notes to include, which you can see organized for you in the table. That means everything else can be omitted. So we had 3 speech pathology letters submitted for writing week, and I'm going to go through each of these. Now, those of you who are speech pathologists, I'm sure already know this, but there's a need there for you to score an A grade for registration, which means I need to put additional scrutiny on these to see if they meet the standard or not. This is different for all of our other OET professions. So I'm going to be much more strict and picky with these letters because I need to be to give you good advice towards your test. So here is the first letter, which was submitted by Lace, and I'll give you a minute to read it and then comment in the chat box whether you think this is a strong or weak letter to explain the situation. So have a look at this letter and let me know, do you think this is a strong or weak letter for this particular set of case notes? What are your thoughts about this letter? Do you think it's a strong response or a weak response to the case notes? In my opinion, and we'll look at some examples of where these lie, I would say there's a lot of good points about this letter, but there are a few weaknesses too. So let's have a look at those in a little bit more detail. So the first question I want to ask again is looking at this reason for writing. It's so important to get a clear reason for writing at the start of your letter so that you get a good score for purpose. I can see Hamid and Robin are both saying this is a strong letter. There's certainly a lot of strengths to it. So let's answer this poll question. Has the reason for writing been clearly explained at the start of the letter? So you can either comment in chat or click on the link that you can see in the poll now and let me know if you think, yes, it is clearly explained, you think it's partially explained, or no, you don't think this is well explained. So just looking at the paragraph, the introduction that you can see on the screen now, do you think the reason for writing has been clearly explained? So we've got one vote for partially and one vote for no at the moment, now up to 2 votes for partially. What do you think? Is there a clear reason for writing at the start of the letter? Robin in chat is saying yes. Paul is saying it's a very good intro. Posty saying partially. Okay, so we've got some mixed opinions. Most people saying partially. In chat, we've got a little stronger saying yes, it is a good response. So let's look at it together. I would say that this is a clear explanation for the reason for writing. And the verb choice continuing here is appropriate to explain that this is going to be ongoing treatment. Essentially, it's a handover from one speech pathologist to another. So it is appropriate to use that verb here. Both of the patient's current diagnoses and reason for handover care have been mentioned. And so my tip for purpose is to choose a verb that explains the reason for writing to match the situation you are writing about. And there's a wide variety of verbs you can choose from. And this helpful article on purpose that we're posting into the chat now goes through a number of the different verbs you can choose from to select one which is most appropriate to your reason for writing. And this covers all of the OET professions. So definitely have a look at that article after this session. Now, if you had written this letter, I'd like to know if you would have included all of the details about Mr. Mack's treatment history with you. So have a look at the paragraph on the screen now, which covers the patient's treatment history with you. And then click on the link in the chat to let me know if you would have included all of these details. So that's a yes. If you wouldn't have included them all, that would be no, or if you're not sure. Thinking about our reason for writing, handing over this patient's care to a new speech pathologist and his recent swallowing assessment, would you have included all of these details about the patient's treatment history with you? Yes, no, or not sure. So we've got a yes come through on the poll. What do you think? So we've got a yes and a no in the poll, and Jacqueline and Posty in the chat are both saying yes. Robin is also saying yes. I'll just give you 10 more seconds to answer the question if you'd like to. We've now got two yeses, one no, and one not sure in the poll. Okay, so what I would say, and think back when we were looking at the case notes together earlier on in the session, and I asked you to summarize the treatment record with the patient. The reader doesn't need all of this detail, perhaps just that the patient's condition has deteriorated so that now he eats a soft diet and crushed medications. The techniques to work on those deteriorations and the specific details of the visits, they have now been superseded by more recent events. And if you look at the letter at the whole a little bit later, there have been a few details from the swallowing assessment done today that have been omitted, and that stands out more when irrelevant information has been included. So during the reading time, try to read the case notes more than once. Sometimes your first thoughts about what is relevant to include from your first reading of the information might change once you have an overall understanding of the situation. So overall, while the letter is very confidently written and it is clearly organised for the reader, there are sufficient problems with this letter to pull it down from being the test-ready standard for a speech pathologist. The last paragraph is noticeable in particular for having more language mistakes in it, which suggests that this candidate was running out of time, and this caused a loss of accuracy at the end of the letter. So I would recommend working on more careful selection of the details to include and omit, and that should help also avoid that loss of accuracy at the end. So here's the second letter, which was submitted by Adrienne. And again, I'm going to give you 1 minute to read through it. And then I'd like you to comment in the chat specifically about the organisation of the letter. Do you think the letter is well organised in terms of what the reader would be most interested in? So just take 1 minute to skim over the letter and then let me know in the chat if you think it has been organised clearly for the reader or not. Just give you 20 more seconds if anyone wants to say if they think the letter is clearly organised for the reader or not. Jacqueline is saying it's good that they've added the patient is relocating. Yep. So what I would say about this letter is that the first 3 paragraphs have been clearly organised and one topic is covered in each paragraph. But the 4th paragraph is a little bit repetitive and it could have simply finished with the closing sentence without needing to repeat the reason for writing, which had been fully expanded at the beginning of the letter. So remember, I was saying if you have fully expanded the reason for writing at the beginning of your letter, there's only a couple of short requests that you're making, then you don't need to repeat that in your final paragraph. You could simply finish with a closing sentence. So another question to ask about this letter, if you were reading this letter, and I'm just showing you the first half of the letter now, I'd like to know if you would understand why an assessment of this patient had just taken place. So we've got a poll question this time. Click on the link in the chats now and let me know if you think that you would understand from this part of the letter why the assessment had just taken place, you wouldn't understand, or you're not sure. I'll leave the letter up on the screen for a few more seconds just for you to have a check, and then let me know in the poll if you think you would understand why the patient had been assessed, you wouldn't, or you're not sure. So we've got a no coming through on the poll now. We've got a not sure as well. Robin is saying no in the chat. We've got 3 no's in the poll as well. Okay, just give you 10 more seconds to answer the question. Aliyah and Sarish are both saying no. Jacqueline, not sure. All right, so I would say that this was a common problem across all 3 letters that were received. The one we just looked at did mention that the patient had been hospitalized, but from the case notes, we can see that the assessment was conducted today as a result of the patient's hospitalization from a chest infection and from a request specifically from the doctor to conduct the assessment. So these are all details which would have been useful for the reader who may otherwise reach the wrong conclusion that the assessment was purely in readiness for the patient moving location. So my tip here for content is briefly covering the context of your involvement is helpful clarification for the reader. In this case, it was because of the patient's hospitalization. In other situations, it can be that the reader initially referred the patient to you and you're now providing them with an update. So if there is this kind of connection, make sure you briefly mention it as the context at the start of your letter. And One final question about this letter. I want to ask you if these opening and closing language statements are appropriate for a healthcare letter. So there's a link coming through for the poll question now, and you can choose between appropriate or not appropriate. So there's a sliding scale for you to choose from. Looking at the opening and closing of the letter, would you say these are appropriate for a healthcare letter writing task? All right, so in the poll, we've got not appropriate coming through. A couple more answers still on the not appropriate end of the scale. Not appropriate coming through in chat as well. Jacqueline is saying, on the other hand, they are appropriate. All right, so what I would say about this language is if you've been given the name of the reader, you should use it. So we've got the reader's name, which is Mr. Noel O'Hara. So only use the reader's job title if you don't know their name. If you have their name, then it should have started Dear Mr. O'Hara. If you haven't got the name, it just says write to the speech pathologist, then Dear Speech Pathologist is suitable. But when you have the name, then you should use it. And to end the letter, the correct ending here is yours sincerely. So the yours is missing. These are small things, but as I mentioned with speech pathology, the small things count for more because generally candidates are doing quite well with the bigger things. And so it can come down to whether the little things will allow you to get the A grade you're working for or not. So my tip for genre and style is to use or learn the correct way to open and close a letter, and then make sure you copy the reader's name or job title if their name isn't provided accurately into your letter. So overall, some positives about this letter is there's good summarization in evidence in paragraph 2. The other criteria are done pretty well. But to feel confident that this letter would be test ready for speech pathology, I would recommend this candidate works on having a really strong opening sentence. The one here was a little bit clunky and it could have been expressed in one sentence rather than two. And also to learn some common collocations. So for example, with thickened liquids or during the thickened liquid testing, there was some incorrect collocations, combinations of words that would be commonly used in speech pathology that this candidate could do with learning. So there's one final letter that I'm going to talk about, which was submitted by Theodie, and I'm going to pick out a few things about its strengths and weaknesses. So this letter also had a clear reason for writing, which was expanded in the first paragraph. Like the last letter, there wasn't an explanation for why or when the assessment took place, but other than this, the organisation is done well. The area to work on for this candidate is language accuracy. So making sentences as clear and succinct as possible. So the highlighted sentences you can see on the screen now could perhaps have been written a little bit more succinctly. And then avoiding phrases such as on the other hand, which is a little bit informal for this letter and don't really add anything to the sentence. It could have been omitted and no detail would have been lost for the reader. So if you are a speech pathologist watching, it was great. It looked like we had about half a dozen of you today, which was lovely to see. Let me know in this poll question if you feel you've learned some useful tips to improve your writing from looking at these samples together. And we're also sharing the link to the official sample letter for the speech pathology case notes for you to use and compare with your own. All right, that's great. I can see a couple of results coming through in the poll to say this was helpful. So that's really good news. So we're coming on to occupational therapy now. There wasn't anyone at the start of the session who was identifying as an occupational therapist. If anyone has now joined and is an occupational therapist, please say hi in the chat box now to identify yourself. It would be lovely to see you here. Thanks to Robin. I'm glad you found those tips useful. Alfie, please do contact the customer service team with your question, and we can post a link into the chat now about how you can contact them. Just giving a couple more seconds in case any occupational therapists are here. Great, Jacqueline is saying I'm an OT, so that's really handy to know. And Jacqueline, this is going to be just for you and anyone else who perhaps is watching the video later. Remember, if you didn't see all of the session, then they will be available to watch through the OET YouTube channel at Official OET, and you can see those after today's session. And we've got another OT joining us today, so that's excellent. We've got 2 of you here at least. So let's go through the occupational therapy case notes. If you haven't seen these notes already, we're posting them into the chat box now. You can download your own copy, and we'll go through how to select the information that you need for this set of case notes that's popped up on the screen now. So from these case notes, we can see that you are writing a letter to conduct a home assessment for Mr. Arthur Jameson, and we are going to inform the patient's doctor of this assessment and recommendations for our treatment of him. So this information comes from the start and the end of the case notes, and this helps us to understand the basics about this case. From the last 2 sections of case notes, which you'll know that I tell you is a really good tip for making sure you've completely understood the situation, you can see that you have a plan to meet with the patient's family weekly, to meet the patient weekly for the next 6 weeks, which involves meeting with the patient's family as well, and that you're going to hold a review at the end of 6 weeks to determine if further intervention is needed. So this directly relates to the second part of the writing task, which is your recommendations for treatment. Looking back at the occupational performance section, we can see that there is a mix of objective and subjective information, and the objective details such as difficulty mobilizing, presence of dysarthria, watching TV for most of the day will be worth including. We can also find details about the patient's thoughts about moving to an aged care home and his son's opposition to this, as well as the support the patient is currently receiving from his family. From the remaining sections of case notes, only the detail in the referral section, which is the context for the assessment, is important. The doctor would already be familiar with all of the other details. The doctor has referred the patient to us in the first place. That's a really important detail to pick up and to include in your letter. So this table contains those details that we've just agreed to be important to include in your letter. And we're going to look at the example of an occupational therapy letter which was submitted by So Yi. Thank you very much for doing that. So here it is on the screen, and I'll give you a minute to read it, and feel free, if you're any profession still with us today, or if you are an occupational therapist, to comment into the chat box whether you think this is a strong or weak letter to explain the situation. So I'll just give you a minute to read it through, and then I'll let you know as well my opinion on whether this is a strong or weak letter. That's great. So we've got the actual author in the chat today. So that's great to have you here. Let's talk about your letter then in some more detail. So I would say there are some strengths to this letter. Oops, sorry, I've gone ahead too far. And I'll explain what those strengths are. But there's also some areas which could be improved on, and we can all learn from those as well at the same time. So let's look at the purpose of the letter. It's done in 2 sentences. You can see on the screen now. Do you think the purpose of this letter is clear from the beginning? And you can vote in the poll question, yes, no, or not sure. What do you think from those 2 sentences, remembering that we are writing a letter to the patient's GP? Do you think this is a clear explanation of why we are writing? Let's have a look at the poll responses. So we've got 1 partially and 1 no. Just give you 10 more seconds if you want to answer that question. Okay, so most people are saying partially. So what I would say about this letter is that the reason for writing is only partially apparent. The assessment and recommendations have been mentioned, but to further personalize the introduction, it would have been good to mention the reason the assessment was conducted. Essentially that the referring doctor's concern is about the patient's lack of support at home. So including that connection would have been useful. And that's my tip for purpose here, that if you are responding to initial referral or request from the reader, mention this briefly for context at the start of your letter. All right, let's look at paragraph 3. And I want to know your opinion. Do you think this paragraph is relevant information to include for the reader? Yes or no? So you've got a sliding scale to choose from here. Do you think this information is relevant or not relevant? What do you think? Is this detail about the patient something that the doctor needs to know, or it is irrelevant? So we've got a couple of responses that are going in the middle on the fence. Paul in the chat is saying it's irrelevant. Jacqueline is saying, I think it's informal. Maybe you meant irrelevant. Posty says no. Hi is saying no as well. That's right. So I would agree with you that this detail is historical And in any case, the doctor may already be aware of it, or it has no bearing on the current situation, so it can be omitted. So my tip here is for conciseness and clarity. Only include information the reader needs to understand the outcomes of your visit or to provide ongoing care, which obviously depends on the situation. This one is about a visit to the patient, but it could be to provide ongoing care. Part of the writing test is to see if you can select information to include and omit. And the table that I showed you a few minutes ago is a really useful way of making sure that you do that accurately. One more question about this letter. I want to know if you think the occupational therapist's recommendations are clearly expressed in the last two paragraphs. So what do you think about the recommendations? Do you think these are clearly expressed, in which case choose yes in the chat or in the poll? If you don't think they're clearly expressed, choose no, or if you're not sure, that's an option as well. What do you think? Are these recommendations clearly expressed in the two paragraphs that you can see on the screen? So, hi, Diary is saying yes. What do you think? We've got a no in the poll. And we've got a yes and a not sure. So let's look at it together. I would say that the first two sentences are done really well, but then the ownership of who will do the mobility assessment and 6-week review becomes confused. The occupational therapist is going to do both of these, but this isn't what has been written in the letter, unfortunately. So my tip here for content is to keep checking the case notes while you are writing to ensure your letter is as accurate as possible and you're not misrepresenting any details. So overall, and I know you're here with us today, this candidate has done a good job of communicating the information from the case notes for the reader, and the organisation is also done well. It's been organised into clear sections. What I would pick out above the things that we've already mentioned is it's unnecessary to use the patient's full name.
Hello everyone, but having a little bit of a technical problem here, but we'll be back very soon. And just to come back, I'm just going to be sharing right now the official sample letter for the task in the chat. And I think you could take a minute and download that and have a look at that. So just sharing the sample letter in the chat right now, and we should have Rebecca back shortly. Great. And we're going to be continuing soon, but just to come back to what what Rebecca was discussing about the full name. So it was not necessary for the patient to use the full name every time it's mentioned, and the recommendation is for the full name in the introduction and then the title and family name for subsequent paragraphs. So the candidate would need to work on identifying information which can be omitted from the letter, as well as for improving the overall accuracy of English. So thanks so much for submitting that letter there. So just a word about the sample letter that I've shared in the chat now. So as you can see in the sample letter, a similar approach was taken to the one that, just like the letter that we've just seen. But remember that there's more than one way to write the letter, and the score that you to write the letter and score the OET grade you want. So you can see in the sample, there's 4 paragraphs: the introduction, the results of the assessment, the patient's wishes, and plan. And the introduction explains the reason for writing. Sorry, the introduction explains the reason for using much of the language from the writing task, and also makes the connection with the doctor's initial referral. And you can also see in the sample that if you've downloaded it just now, you could open that up. You can also see that neutral language has been used to describe a sensitive situation. The current amount of support provided by the patient's family and the son's opposition to the patient's consideration of moving to an aged care facility. So that has been described in a very neutral and a very sensitive way. And then, of course, in the sample, you'll see that the final paragraph clearly lays out the OT's plans for the next 6 weeks, so that the reader would have a clear understanding when they may receive a further update. And we have Rebecca.
Thank you, Shekinah. You did a great job. I'm so sorry, everybody. My battery died. I thought I had it plugged in properly, and it died, so I just came back online. But Shekinah was doing a great job there, just finishing off the rest of that session for occupational therapy. So she did bring us to the end of the session on occupational therapy, and you can see those details in the official sample letter, as well as the link that she posted in the chat. Now, if you're looking for some further guidance for writing, having listened to today's session, all the case notes and official sample letters for the tasks will be available on the OET website next week. But in the meantime, do make sure you've bookmarked as a favorite or downloaded the OET Writing Guide, which you can see on the left side of the screen, and we're posting in the chat now. And we're also adding a link to the assessment criteria, which you can see on the other side of the screen, which I've been referencing during today's session with all of my tips. They all relate specifically to one of the assessment criteria, and again, is really something that you should have handy access to and be regularly checking. So if you haven't already tried writing a letter for these case notes, I would suggest trying your own letter before you look at the sample answer. And consider making use of the table that we've looked at during the session to make sure that you are correctly selecting the details you need to include, as well as helping you to decide which details to omit. All right, so thank you so much for joining us today. It was lovely to see all of the different professions represented during the week, and we'll see you again soon. Bye for now.